last 24 hours is 7,728. Well, today I just want to reassure Queenslanders that we are doing absolutely everything we need to do in case we do have a COVID outbreak. And what you're seeing here today behind me is our shield against COVID. We are making sure that we have the PPE stockpiles that we need in case we were to see an outbreak. And from the outset, can I thank Dr. Young, because Dr. Young was preparing and planning for an eventual pandemic long before the pandemic hit our shores. So Queensland was well prepared way back in the end of January, early February, when we actually started to get some of our stockpiles. What you see here today is a brand new warehouse. It's being expanded. We are doubling our capacity, and we have 10,000 crates of PPE here in this facility. I'm also very pleased it's in my electorate as well, so thank you, Deputy Premier. But what we know is that we have to plan for the future. We have to plan just in case, and this is our defence, this is our shield against COVID. So just to give you an idea, we had planned around 9,000 square metres of stockpiles. We are doubling that capacity just here, and the Deputy Premier will talk about our expansion across Queensland as well into some other regional centres. So this facility stores 120 million pieces of PPE, and the expansion means we can store 180 million pieces. Together with our distribution centres, we have 900 days worth of surgical masks, 200 days worth of medical gowns, 300 days worth of gloves permanently on hand, and that's stage one. Stage two is to manufacture more of this equipment in Queensland, and that is already underway. So you may recall a few months ago we went down to Evolve. They are just getting their federal accreditation to be able to do mask manufacturing in Queensland, and that means more jobs for Queenslanders. Of course, some of the equipment comes from other places overseas, but I want to see Queensland have the capacity also to produce some of the equipment here, and that is exactly what we are doing by backing local manufacturers like Evolve. So I'll hand over to the Deputy Premier and then Dr. Young, and then we're happy to take some questions.
Thanks so much, Premier. Throughout 2020, Queensland's healthcare workers have had our backs, and today is all about making sure we have theirs. I can't tell you how excited I am to be here at this facility and sharing with you the work that we have done to expand our critical supply stockpile. When I think about the nights I've lost sleep throughout this pandemic, so many of them were about the potential shortage of protective equipment. I wanted to make sure that our staff were safe and felt safe every single day, and I wanted to make sure that they could continue to treat Queenslanders. Of course, nationally, we had to suspend elective surgery, we had to suspend many procedures, we had to suspend a lot of oral health care because we were concerned that nationally there was not enough protective equipment. And we resolved, the Premier and I and the government resolved, that never again should our healthcare staff have to worry about having the equipment they need to keep themselves safe. Never again should a doctor have to worry if there'll be a surgical mask available for them. Never again should a nurse have to worry if there'll be gloves in his or her size. And that is precisely what this is all about. The Chief Health Officer already had one of the country's biggest stockpiles of masks, and that kept us safe during this pandemic. But what we want to do is so much more than that. We want to make as much equipment here in Queensland as we can. We want to keep it here. We want to have it ready if there is a COVID outbreak, if there is some other reason why global supply chains are disrupted, and of course, one day there'll be another pandemic, and we want to be prepared for that. As the Premier outlined, we now have more than 100 days of most lines of equipment that we need. This new giant storage site will allow us to buy in bulk, will allow us to more creatively procure, will allow us to provide support to local manufacturers so that they know that they will have a purchaser for their product. But I hope that most importantly, it gives our healthcare staff confidence. Confidence to know that we have the equipment that they need to do their job. They do not need to lose sleep at all over the availability of protective equipment because we have this giant resource, this giant critical supply reserve standing behind them that we will continue to expand upon. There's actually some fantastic technology that sits behind this. Most of this equipment has expiry dates, needs to be rotated to ensure that it isn't expiring, that it's always in date. Prior to COVID, we would hold on hand $15 to $20 million worth of stock. We now have $110 million worth of stock, roughly $60 million worth here at this site alone, and of course we intend to continue to fill it. We took this space, we got the keys to this space just 2 months ago, the expanded space just behind you a few weeks ago, and it will be continue to be stocked. I want to personally thank Barbara Phillips and her team. They have done just an incredible job delivering on this vision of ensuring that we have the reserves that we need for whatever might come at us.
So no new cases of COVID-19 in Queensland overnight, which is excellent news. And thank you to the more than 5,000 Queenslanders who went and got tested yesterday. That's so important. It is just critical that we find the first case in a chain of transmission, not the 20th case, when it makes it much harder to deal with. So that is excellent. So to all Queenslanders, if you develop any symptoms of any sort, please come forward immediately and get tested and isolate yourself. Also, it's still important to maintain social distancing, so to minimise the impact if there were a case, and also don't go to places where there are high numbers of cases. Now, this warehouse here today is a fantastic initiative. It's been put together by a great team of staff who have worked solidly over the last many months since this pandemic was announced to source the PPE needed to keep everyone in our health system safe so they could treat patients. That's been fantastic. And I also commend Barbara Phillips, standing over there, and thank her for leading this work and the great team that have done all this. It's not easy to go out and find all the equipment that's needed in a time when there's a worldwide shortage. So this will stand us in good stead going forwards. Then also, of course, for the money that has been put aside to fund this is critical. It means that that resource is there and it's there as we go forward. Thank you.
Any questions?
Premier, how much of this is made in Australia and how much are we sourcing from overseas?
Yeah, look, a lot of it's sourced from overseas, but we are now turning our attention to manufacturing in Queensland. Okay, so there are some specifics that cannot be manufactured here. We know that, but we now have this fantastic stockpile. And let's not forget, when the pandemic first happened, countries' resources were stretched to the limit. Everyone can remember those images of doctors and nurses scrambling to get whatever protective equipment they could. What I want to reassure all of our health workers is that we have planned for the future. This is a lot of detailed planning has gone into this, and as you can see, a brand new facility here. This is not the distribution centre. This is just a storage facility. So there is a lot more in Queensland, but this is about keeping Queenslanders safe, and it's an extra shield against COVID.
What type of items can we make here in Queensland? How are you going to get manufacturing?
Yeah, so we're looking through all of that at the moment, but like I said to you, we went down just recently and looked at Evolve, and they're just getting their accreditation now to do the surgical masks.
Can you tell us about the latest, the has written to yourself
sure.
and other premiers. What's in that letter and what is it?
Yeah, look, the Prime Minister's written to all premiers. We only just received that letter. It's a very generic letter, and of course we're happy to have further discussions at National Cabinet.
So does it raise any issues about transport and freight and movement of freight? And that
It's
sort of
just a very generic letter. It talks about health, it talks about, freight. We have a national agreement about freight and about the testing of drivers. And in relation to health, we want the best healthcare for all Australians, no matter where they live. We know New South Wales residents have hospitals located close to where they are, but if there are extenuating circumstances and whether they are on other sides of the border, of course the Chief Health Officers will speak to ensure that that person gets the best critical care. Yeah. Yeah. Lane, these decisions are made by health professionals. They're not made by politicians. They're not made by premiers. I'm more than happy if you want to talk to Dr. Young about the specifics of that case, but where there is critical care, the doctors will make those critical decisions. They are not for politicians to make those decisions. Well, you have to understand too, like people living in New South Wales, they have New South Wales hospitals. In Queensland, we have Queensland hospitals for our people. So if there are specific issues, I'm quite sure that the clinicians will make the best decisions based on the evidence that they have before them. They're not the decisions that we make. I don't know the specifics of that case. I'm happy to ask Dr. Young to get more details for you. Do you have any details on that, Lane?
I don't have the details of that case, of course not. I'd need to know their name and so forth, but I can tell you the standard. If any hospital in Queensland accepts a patient from another state because they believe that's essential for the care of that patient, then an exemption is given.
sort of similar case, there was a woman south of the border whose newborn baby had to come here to Queensland, and the parents are saying they're not allowed to come to Queensland to be with the newborn baby. Do you know anything about that? Have you got details?
Again, they need to put in an exemption and there has not been any refusal. So they just need to put an exemption in through the Health Directions website and that's then assessed. And if a child was in Queensland whose parents were elsewhere, then of course we'd allow the parents in.
Sorry, Dr. Young, would they have to go into quarantine if they came to Queensland, or could they go and be with their newborn straight away?
Right. Virtually anyone who comes to Queensland must go into quarantine, but there are exemptions to allow people to leave quarantine. So they need to wear PPE, they need to go to a facility where they can be supervised in terms of their interaction, because of course we don't want them to potentially spread COVID to other patients who are in that facility. Yes, so the 4 individuals were tested in that nursing home. 3 results have come back and they're all negative. We're still waiting on the 4th result, but we understand that 4th patient hasn't had any new symptoms. It's just been a continuation of their normal illness, and they're being tested, so I suspect it'll be negative, but it's very, very good to see what the aged care facility did, that they went ahead and tested those 4 people. Yes, the number of exemption requests has gone up, and it depends on what the exemption is for. So some people have an urgent reason to come into Queensland, like some of the things we've just discussed now. For other people, it's a more delayed reason. So it depends on what the request is for. At the moment, they are still coming across my desk, but we are working out a process, given the large numbers, as to how to manage that.
Yeah, so look, during COVID, we don't want to see large gatherings of people. We've made that very clear. My understanding is the police advice was that they did apply for a permit. I haven't had any further details about that.
Is it disappointing to see groups still coming
Well, we're allowed to have gatherings of 100 people in our homes. I don't know how large that gathering was. I'm hearing it wasn't a very large gathering. Their issues are with the federal government, and I urge them to take up their issues with their elected federal representatives. In relation to what specific recommendations are you referring to? Yeah, look, we've got some of the strongest prevention of domestic and family violence laws in the country. We will always be looking at doing more, and that's why we have a specialist task force that is headed up. It's a permanent task force that's headed up by Bob Atkinson and Kay McGrath.
When are we going to see some legislation introduced?
Well, we don't have any specific legislation at the moment.
What about the stuff the MPs introduced in relation to like hackers and strangulation?
We've already got the laws in about strangulation. I'm happy to get more information for you. I do not have that at hand at the moment.
And you previously said you weren't in a bipartisan way with the MLP on this. Have you had a meeting with the opposition lately?
They're more than happy to have meetings with the relevant minister, as they are having with child safety.
So
Premier-
you're not going to sat down and with the opposition leader to try to figure out.
But there's been no request. There's been no request from them.
But you're the leader. Why
Yeah.
can't you reach out to the opposition?
Sorry, we have a task force that is set up, that is made up of whole different stakeholders that are united on this, and then they make recommendations to us. And I'm more than happy to talk to the minister about it.
Premier, just on
Yes.
shield laws, are you personally concerned that Queensland's the only state in Australia that doesn't have shield laws for journalists?
Look, we're happy to look at that, as I said the other day.
What do you make of the opposition's plans to refer that?
Well, the
to
last time the opposition was in office, they wanted journalists sacked, and they abused journalists walking down the street.
But what do you make of that plan to refer it to the Queensland Law Reform Commission? Would your government commit to doing the same?
The Attorney General's happy to look at it. I said that yesterday.
Dr. Young, can I just
Yep.
quickly ask you, sorry, about the letter that you sent to the Speaker of the Federal Parliament yesterday? What's it going to mean? What do you want for MPs who are going down to Canberra? What's going to have to happen when they come back, if they go?
So MPs who go down to Canberra when they come back will be required to quarantine for 14 days on return. However, they can do that in their own home if it's suitable for that purpose, given that this is an essential requirement for them to go to Canberra.
And they would just have to let you know that they would be quarantining at their home or something like that?
Yes. Yeah. So they have to remain in quarantine on the carrier until they've been there for 14 days, and they'll get tested again at day 10. No.
And sorry, can I just check, with those MPs, if they quarantine in their own home, what happens to their families? Can their families be there with them at the
Yes.
same time?
Yes.
Well, how does that work if their families are going out into the public?
Because they're not a case.
Yeah.
So until you become a case, then you can interact in your family. But if they were to become a case, then everyone who lives in that household would then have to go into quarantine.
Premier, just on the shield laws again, you said the Attorney General will look at it. What do you mean by that? How will she look at it?
Well, she will look at any recommendations about it.
Has she received any recommendations?
No, she hasn't. Oh.
Then what's she going to look at then?
Well, she said she will look at the principle of it. Okay? Anything else? I think what we need to make sure that Queenslanders are practicing their social distancing. That is absolutely important. They need to keep doing their good hand hygiene, and they need to follow the COVID safe plans that industry has put in place, such as making sure that you leave your details, your contact details, if you are going to a restaurant or a cafe. So in the case where there needs to be rapid contact tracing, we can do that rapid contact tracing. These are the things that all Queenslanders need to do to keep Queensland safe. I don't have a crystal ball. I mean, you've listened to people from the Doherty Institute say they work in a 2-week proposition here. We have to look as far to the future as we can But I think what Queenslanders can sense that they can go about their daily lives, they can go to work, they can conduct their business, which is not the case in other parts around the world. And my priority is to keep Queensland as open for Queensland as much as possible during these times. That is why National Cabinet's very important, where we discuss the situation in all the different states and territories. But Queensland is not alone. We're not the only state that has borders closed off. We've got those in other states as well and territories. And what you have seen is where those states have hard border closures, we do not have a large number of cases. In fact, it's been now 29 days since there's been any community transmission here in Queensland, and that's because of Queenslanders. Well, my understanding, Lane, is that they've just declared the City of Sydney a hotspot. My understanding is that there was a detection of someone, I think it was on Channel 9 just reported it, that there was, I think it might have been at the markets, and there's been a couple of other cases. So look, we are still very concerned about New South Wales, and of course we are watching very closely if there is any movement of cases detected in northern New South Wales. It's absolutely critical that we keep on top of that, and as I said, we talk about that every single day about what's happening in other states. I can't make those decisions. That is looking too far down. I know people want certainty, but we can't give that certainty when the situation is currently evolving and changing. And as you're seeing, there are more hotspots being added in New South Wales. Okay, they've had cases in Newcastle. So that is something that we are monitoring. But the situation in Victoria, of course, is very concerning. It's very concerning to everyone in Queensland. Well, look, we hope that Victoria gets their numbers under control, their cases under control. I can't deal in hypotheticals. I will make the decisions in the best interest of Queenslanders to keep Queenslanders safe. That is the thing that I have to do. Yes. Lee, if you've got specific questions, I'm more than happy to talk to you about those and get the information from the Minister for Domestic and Family Violence. Okay? Yeah. Yeah, I know, and I've met with them, and it was absolutely horrific what happened to Hannah and her children. I went to the funeral. It was awful, okay? We don't want to see that happen again. And, you know, it is very upsetting, and anything we can do to help, we will do. Okay? We had all of the recommendations from Quentin Bryce. We acted on that. We implemented all of those recommendations. We have some of the strongest, most robust laws in the nation. If we can do more, of course, we will look at doing more. Okay?
So where are we up to on the pandemic leave for health workers, and do we know how many days they'll have?
No, not at the moment.
No.
Okay. All right. Thank you. We're working with